So my take on steroid injections is I try to hold off as long as possible because early on, you don't know what's just natural swelling versus actual excess soft tissue. I think steroids are helpful to try to thin out soft tissues eventually because we all know that swelling eventually is going to go away. Any inflammatory swelling eventually has to go away with time. But what we worry about is sometimes there's some soft tissue thickness. Some people call it scar tissue, but it's more often not just scar tissue. It could be actually that your soft tissues are thicker in one area of your nose than another. And really, steroids can help with that aspect. What it won't do is change the structure underneath, but you can firmly press your fingers and feel the structure under that soft tissue. And if it feels crooked or feels too wide and you hit a hard wall, of course, it may be too thick. Now you got to remember the blanket on top sometimes has areas of more or less thickness. And if one area feels thicker than another, that's a great way to use steroids because you're trying to thin that thicker area so that that area could thin to match the other side. And that, of course, can make the nose look asymmetric and everything else. So you really want to separate what structure of the nose that we work on in rhinoplasty versus the soft tissue that lives on top. Steroid can't change the structure. Only surgery can do that. But steroids can affect the soft tissue or that blanket on top that may be too thick in one area.